Hi, my name is Michelle Mazzanti, and I will be presenting Case Study 1 for my selected client. Okay, so I will begin with the available client records. The client is a 6-year-old female with a diagnosis of autism spectrum disorder, which is DSM-5 code F84.0. The client is in first grade and attends school full-time, Monday through Friday, 8 a.m. to 2 p.m. She also receives speech and language therapy in school. The client has no known trauma history and shows no signs of depression. Allergies and recurrent ear infections are the only known medical issues for this client, and the client is not taking any medications at this time. The client's family is engaged and supportive. The client's mother works with and receives support from a CMO and also receives respite care. The client was referred by her mother and pediatrician to assess the need for ABA services. Next, I will discuss the assessments used for this client. The assessments conducted for this client were the VB-MAP milestones and VB-MAP barriers assessments, the SRS-2, which is the social responsiveness scale, and the Vineland-3. These assessments were selected because they are age appropriate for this client and are widely accepted across insurance providers to show client deficits and needs for services. I will now discuss the VB-MAP barriers assessment in a little bit more detail. So the VB-MAP barriers assessment was used to assess behaviors of concern. This assessment rates 24 learning and language acquisition barriers. For each for each of these barriers, the child receives a score of 0, indicating no problem, 1, an occasional problem, 2 indicates a moderate problem, 3, a persistent problem, and 4 indicates a severe problem. So the child can receive an overall score from 0 to 96. 0 indicating the least number of barriers and 96 indicating the greatest number of barriers. The barriers assessment results for this particular client. The client demonstrated elevations on 18 of the 24 barriers with an overall score of 24. The client scored the highest in the negative behaviors category with a score of 3, indicating that negative behaviors are a persistent problem. In addition to the above-mentioned assessments, an FBA and FA, or functional assessment, were also conducted. The FBA identified the following behaviors of concern: flopping, aggression, elopement, refusal, and tantrum. We'll now discuss the functional assessment results. I will give an operational definition for each behavior as well as the identified function. A functional assessment was conducted to determine the function of these behaviors. So first is flopping. Flopping is operationally defined as any occurrence of the client falling to the floor that is not contextually appropriate. The function of this behavior is determined to be socially mediated negative reinforcement in the form of escape from demands. Next is aggression. Aggression is operationally defined as any instance of the client using an open or closed hand to make forceful contact with any part of a person's body or pulling another person's hair. The function of aggression is determined to be socially mediated positive reinforcement in the form of gaining access to preferred items and activities. Next is elopement. Elopement is operationally defined as any instance of the client moving more than 3 feet from the designated area without permission. The function maintaining elopement is determined to be socially mediated negative reinforcement in the form of escape from demands. Refusal. Refusal is operationally defined as any instance of the client continuing to engage in a task or activity for more than 10 seconds when told to stop, or moving away from the designated task or area after a demand is placed. The function maintaining the client's refusal behavior is determined to be socially mediated negative reinforcement in the form of escape from demands. And lastly, we have tantrum. Tantrum is operationally defined as any occurrence of the client whining and or crying and flopping to the floor. The function of the behavior is determined to be socially mediated positive reinforcement in the form of gaining access to preferred items and activities. Once the behaviors of concern and their prospective functions were identified, behavior change goals were put into place. The goals created for this client to function as replacement behaviors were manding for access to preferred items and activities and for escape, such as saying break or all done. In addition, goals were created for accepting delayed reinforcement as well as accepting alternatives. This concludes my discussion of case study 1. Thank you for watching.